Hello all, this is Dr. Rup Kumar. Welcome back to another masterclass series from Dentospedia. Today we're dealing with the sixth session of oral radiology, and today's topic is about faulty radiographs. So what are faulty radiographs? They're kind of a non-diagnostic radiographs, okay? And in the sense these radiographs they don't have any diagnostic value because they do not provide any adequate detail and required information. So we can't rely on these radiographs for diagnosing the conditions. And what is the ideal radiograph and what are the qualities of it? An ideal radiograph should have certain information like it should have proper density and contrast, it should have proper outlines, and the structures present in the radiograph should be of same size and shape as that of object radiographed. Suppose if you are exposing a molar tooth, right? If the radiographic image of the molar is magnified and kind of distorted, you can't diagnose it properly, right? So that's why we have to rely on appropriate diagnostic radiographs, okay? And we can't rely on those faulty radiographs. An artifact or error is an unwanted radio density that interferes with diagnosis. So we don't want that kind of errors that hampers diagnosis. And what are the situations where radiographic errors can occur? So these are the situations, okay, where radiographic errors can occur. Errors can occur in the film, okay. Errors occur during the film placement and projection. Errors can occur during the exposure of X-rays, okay, and errors can occur during the film processing. And we'll learn one by one. Coming to the errors occurring in the film itself, okay. So film itself has a defect. It might be either expired or contaminated. So if we use those kind of radiographs, we will get certain appearance called reticulation appearance, okay, due to damaged emulsion layer. So emulsion layer is a key important layer, right, in the radiograph. So if any damage occurs to the emulsion layer, it might result in this kind of artifact. So you can't diagnose any condition with the help of this kind of radiographs, okay. So that's why it's important to maintain, the expiry date, and we don't want any contamination with the radiographs, okay. And coming to the errors in film placement and projection. The first one is dot artifact. Here you can see the dot, embossed dot. As a rule, the embossed dot should always present at the occlusal side or incisal side, right? But if we place wrongly, the embossed dot is present in the apical region and it might mimic periapical lesion, right? So that's why we don't want misdiagnosis of those normal teeth, okay? So that's why it's important to maintain proper position of the film inside the oral cavity, okay? The embossed dot should always place occlusally or incisally. And second one is cone cut. It is mainly due to improper film placement, okay? If the film is not placed on the area of interest, it might result in cone cut appearance, okay? And the second one is crown cutoff. It is similar to that previous error. It is mainly due to improper film placement, right? If the film is not placed particularly, correctly in the area of interest, so we might get this kind of crown cutoff IOPS. Similarly, roots cutoff, you can, if the film is placed more coronally, the roots might not be visible in the radiograph. So that's why it's important to place the film perfectly during the exposure, okay? So with these kind of radiographs, you can't assess the periapical region, right? And coming to the another important appearance, that is tram track appearance, herringbone appearance, or tire track appearance. This is an important MCQ. So you might have learned about the film packet, right? What are the different components in film packet? When you open a film packet, we have certain components like black pepper, film, and lead pepper, right? So, and also this film packet has two sides, tube side and label side, right? The tube side should always face the cone, right? and the label side should be always present back side of it. Okay, so when we place reversely, when label side is facing the cone, we will get this kind of artifact. Usually the lead paper has certain kind of appearance. There might be certain serrations or design on lead paper, and that design will be replicated on the radiograph. If it is, if the label side is placed on the towards the cone side, okay, towards the cone. So that's why it's important to uh, assure that the cone, the cone side of the film is placed towards X-ray exposure. Okay. And coming to the white lines across the film, which is also called crimping effect, mainly occurs due to bending of the film. So improper handling can occur, sometimes, and sometimes bending of the film can occur. So this bending of the film will result in this kind of white line, which is called crimping effect. And elongation of whole image. Elongation of image results in decreased vertical angulation. Therefore, it's important that appropriate vertical angulations must be used while taking intraoral peripheral radiographs. So we have discussed about vertical angulations in bisecting angle technique, right? So there are certain angulations for different areas of interest. For instance, some kind of angulation for canines, there are certain angulations. And if we don't maintain that kind of protocol, we will get elongations in the images, right? And elongation of few teeth. In this error, all the teeth in the radiograph are kind of elongated, right? In certain situations, there are some errors can occur where few teeth in the radiograph are kind of elongated, rest of the teeth are normal in size. Okay, and it might mimic some kind of a orthodontic teeth. Okay, so why is this error occurring? It is mainly occurring due to excessive bending of the film inside the patient's oral cavity in order to place correctly inside the oral cavity. Suppose if the oral cavity is kind of a small, so we have to use appropriate film size, right? We can't use adult size film inside pediatric oral cavity, right? And also we can't bend films in the intraorally to fit in between the tongue and the teeth. Okay, and if there is an excessive bending, this might result in this kind of error. So you can see here the film is kind of a bend here, right? That's why this tooth is getting elongated and rest of the teeth are normal in size. Okay. And coming to the next error, that is called foreshortening. It mainly occurs due to excessive vertical angulation of the X-ray tube during radiography. So we have seen what happens when we don't follow the vertical angulation, right? So if we use excessive vertical angulation, we will get foreshortening of the teeth, and if we use decreased vertical angulation, we can get elongation of the whole images. Okay, elongation and foreshortening, they are kind of dependent on vertical angulation. Okay, and you can see the premolar teeth are kind of a foreshortened. Okay, magnification. So similarly, it is another important radiographic error where teeth might be enlarged in radiographic images even though the size of the teeth are normal. Okay, this is mainly due to projection errors. So in order to get good radiographic images, the film should be as close to the teeth, and the cone, the X-ray source, should be as distant as possible, okay, to get ideal radiographic images. And if you don't follow the protocol, we will get this kind of magnification errors. So all these protocols will be learned in projection geometry chapter. And coming to the errors occurring during exposure. Okay, The first error is low density radiograph or underexposure. It is mainly occurring due to low settings like kVp, milliampere settings, and exposure time. So we have a control panel, right? And we have certain settings for kVp, that is kilovoltage peaks, milliampere settings, and exposure time. And if we follow the low settings, right, we will get this kind of a underexposed radiograph, and you can't even differentiate between enamel and dentin and pulp. And these are non-diagnostic radiographs. Okay. Similarly, when we use high settings for kVp, MA, and exposure time, we will get this kind of a black images. And in this picture too, we can't differentiate between enamel, dentin, and pulp. So we can't use these radiographs for diagnosis. And coming to the blank image, if the film is exposed without subject or patient, and then we develop the film, we will get this kind of radiographs. Okay. And similarly, if we use high kVp settings and MA settings, we will get this kind of radiographs. Okay. And coming to the cervical burnout, or also called adumbration, which is an important, radiographic error, or we can say radiographic artifact. Okay. It is a radiolucent band or shadow around the necks of the teeth, more pronounced at the proximal edges. It is mainly due to varied thickness and overexposure, and it mimics proximal caries. Here you can see there is a band of radiolucency here, right? It mainly occurs due to, from the crown to the root, it is present at the junction, right? So at the junction, there will be the crown will be thinning, right? There will be thinning of enamel, and then root will be started, right? So at that position, at that location, there will be decreased thickness of the tooth material. And also in certain situations, we might overexpose the tooth, where high kVp settings, high MA settings, and more exposure time. And if you use those kind of settings, you will get this kind of radiographic artifacts, right? And this is called cervical burnout, and it mimics proximal caries. Okay, proximal caries also has radiolucent areas in the proximal areas. Okay, and these two can mimic each other, and we want to differentiate between these two to get proper diagnosis. Okay, and how do we differentiate between them? And these are the differences between cervical burnout and dental caries. And coming to a feature, that is important feature, that is called borders. In cervical burnout, the borders are diffuse and ill-defined, whereas in dental caries, it is sharp and well demarcated. And location, cervical burnout usually present at the cervical region, but dental caries, it can occur anywhere in the enamel dentin. Wherever there is demineralization, there will be caries, right? An important feature that can differentiate between these two is clinical examination. Okay, in clinical examination, there will be no actual loss of tooth tissue, so you can't see any cavitation here. In dental caries, you can see visible cavitation, right? That's an important differentiating feature between cervical burnout and dental caries. And consistency, it is an artifact. It varies with angle and exposure. Suppose you are exposing the tooth with this angle, right? If we shift the tube from here to here and then expose the same tooth, that cervical burnout will not be present. But proximal caries will be present at the same location. So even the tube shift occurs, the proximal caries will be present, but the cervical burnout will not be present. Okay, that's an important radiographic differentiating point. Okay, but dental caries persist even across view changes. Okay, and yes, you can see the softening and cavitation here. No cavitation and softening of the tooth with the clinical examination, and you can detect any softening or catching of the probe with the clinical examination if there is any dental caries. So that's the most important radiographic error, right, which we have to differentiate between the dental caries. Okay, this is an important MCQ. And coming to the another radiographic error, that is double image. It is nothing but appearance of two separate images on the radiograph. It mainly occurs due to repeated exposure of already exposed film. Suppose if the film is not developed, if the film is exposed and not developed and kept aside, and some other doctor came to the uh, radiology department and then he exposed again, we might get this kind of radiographic errors where you can see one series of tooth and here there is another series of tooth. It is mainly due to double exposure. And another radiographic error is phalangioma, where this kind of error usually occurs in bisecting angle technique, right? In bisecting angle technique, the film is placed in correct position with the help of patient's finger, right? So if we don't follow proper angulation, and we should instruct the patient not to involve too many fingers during the film placement. So the patient has to hold the film with only single finger, right? And if the patient uses one or two fingers, it might get exposed, and then we will get that kind of images, right? Here you can see the finger. And coming to the errors occurring during film processing, okay, and there are mainly two types here: errors occurring due to improper handling and errors occurring due to improper chemicals used in the processing. In the film processing, we might have learned, right, about the developer and fixer, right? And if there is any deviation in the composition, we will get certain kind of errors, and we will learn these in the further slides. And coming to the errors occurring due to improper handling, and these errors are occurring inside the dark room, okay? And when you enter the dark room, we open the film packet, right? During the opening of the film packet, if we open the film packet and remove the film, in a hurry, we will initiate certain kind of a static electricity, okay? And that static electricity result in artifact like grassroot appearance, right, or tree-like appearance, or lightning effect, okay? So that's why this artifact is also called grassroot artifact, tree-like artifact, or lightning artifact. So it is mainly occurring due to static electricity due to rubbing of surfaces. So we have learned, right, the film is placed between two black papers inside the film packet. So if the film is removed from the film packet, without any, in a fast manner, so this results in static electricity, and that can result in this kind of error, okay? And coming to the fingerprint artifact, so during the film processing, the emulsion layer will be kind of a soft in nature, right? During the developing process, the film is kind of soft, so that's why we don't want anyone to touch the film during the processing. And if we touch the film, our fingerprints will be present on the emulsion layer, and this will result in fingerprint artifacts. Okay, you can see the fingerprints on the film. Fingernail artifact, so improper handling during the film processing, okay? Any fingernail can damage the emulsion layer, okay? Emulsion layer is very soft, so we don't want any kind of errors, right, during the processing. So that's why we have to wear gloves, and then we have to process the film, okay? And general scratches can occur, right? Usually these films are placed in the film holder, and then we dry it out, right? So if we don't properly care about the films, we will get certain kind of scratches, right? You can see the scratches of the film. Overdeveloped film. So if we keep the film in the developer for a long time, we will get this kind of an radiographic error, right? It is more kind of a blackish film. Overfixed film. If the film is placed inside the fixture for a long time, we will get this kind of radiograph, and you will see there is no difference between enamel, dentin, and pulp, right? Coming to the errors due to improper chemicals used in the film processing. So we have developer, right, that it has certain composition, and if there is any contamination occurring in the developer, we will get this kind of an dots, radiolucent dots here, okay? And if there is any contamination in the fixer solution, we will get this kind of a white spots. Okay, and that's why we have to maintain, we have to replenish the chemicals once in a while. And coming to the yellow brown film, it mainly occurs due to various reasons. Either it might be if you are using exhausted developer and fixer, insufficient fixing time, or insufficient rinsing with water. So we will get this kind of errors where we can see yellowish brown film. Okay, so that's why we have to follow the ideal protocol during the exposure, okay, and also during the film processing. So this is the end of the session. That's all for today. So we'll meet again in the next session of the masterclass series. Thank you.